So, good day, sir. This is the Group 1's case study entitled The MR Spectroscopy of the Brain featuring a high grade glioma. And this is our case outline. So, as you can see in our study, it is much broad, and since MRS is often used in brain tumor assessment, we are focusing on high grade gliomas and explore its diagnostic importance. So, in this pathology, it's one of the aggressive type of brain tumors, which is either classified as grade 3 or 4, and this is highly invasive and often shows rapid proliferation, necrosis, and also blood-brain disruption. So these characteristics makes an advanced imaging techniques like MRS, our topic, very important for accurate evaluation of this pathology. So it helps us differentiate high-grade gliomas from a normal brain or from a low-grade tumor by analyzing its metabolite levels. So in this pathology, as you can see, choline is much elevated, the NAA is much lower, and CREA is stable or a bit lower, which we will be analyzing later on.
So for the parameter used in MR spectroscopy glioma, brain tumor, we oftenly use a longer echo time of a 144 millisecond. This is to enhance the metabolites such as the NAA and the choline. We oftenly impair with the higher field strength of 3 Tesla. Is to improve the spectral resolution and voxel placement, and should focus on enhancing tumor necrosis, tumor regions while avoiding necrosis. Oftenly, in MR spectroscopy, there are a variation of pulse sequences available. And in this case study, we use the PRESS, the point resolve spectroscopy, or to be specific, the mega press, which uses 90 RF pulse and 2 successive 180 pulse to form spin echo. It is to help detect the 2HG and DH mutant tumors, and lactate editing is useful for identifying necrosis and hallmark of aggressive gliomas. So for the protocols in glioma MRS, we have voxel placement, the water suppression technique, and the single voxel versus multi-voxel. For the voxel technique, instead of using the standard region white and black, we highlight the tumor sites. For high-grade glioma, we focus on active tumor regions, highlighting the metabolites, avoiding the necrotic areas. And also we usually pair this with water suppression technique in order to visualize more the metabolites and reduce any interference of the water and soft tissue. For single voxel and multivoxel, we often use pair with the multivoxel, and particularly useful as it helps for map the metabolic variation across the tumor, providing more comprehensive data.
So now, we will discuss the MRS procedure simulation or the spectroscopy simulation on the machine. So assuming that the patient was already positioned in the machine, the next step is to acquire a weighted image as our some sort of localizer. So per se, we will use a T2 weighted image. And then the next step is to adjust the image resolution parameters, which technically would depend on the protocol set up on the machine. Usually, spectroscopy cannot be combined with images when distortion correction is on. So it can either be a 2D or 3D image, and the distortion correction is usually off when doing spectroscopy, but it would still depend on the protocol set up on the machine. So now, when we are browsing for the procedure, we will select the spectroscopy and particularly the head procedure. And then after selecting our procedure, we can choose what sequence we will incorporate. So depending on the physician, but the SVS is usually for targeted high SNS or the high signal to noise ratio, while the CSI is a summarization of multiple metabolite distribution over a larger area compared to the SVS. In a hospital setting, the 135 sequence is a more common sequence selected, and for simulation purposes, we will follow that sequence. So this is how a CVI should look like, and we can now acquire and adjust our volume of interest and the voxels. So as discussed, fat and water should be suppressed, so when we are selecting our VOI, we should try to keep our voxels within the brain tissue and away from the bone or the scalp. So it keeps our VOI within the tumor area. Upon acquiring the images, this will give us two images. So first is the original image with 2D distortion labeled as DIS 2D and the no distortion image labeled as ND. So similar to that, we can also choose what we would like to image in our SVI or the single voxel, as well as adjust its parameter. So in the next slide, we can see the selected VOI or the volume of interest, which is represented in the yellow box. Once we finished selecting our VOI, the sequences, and the resolution parameters, we can now process our images. So in the application browser, let's select our preset and run the same sequences as we have selected from before. So now we will have a spectrogram which shows both our volume of interest and the metabolites detected in the region. So for the CVI, using the cursor or the cursor from the mouse, we can determine the specific metabolites in the area we have selected per voxels in the region. For example, in this slide, we have selected one box and it showed us the detected metabolites in that specific box that we have selected. And when we select another box, which is shown in the next slide, it will show us a different graph of metabolites in that specific voxel. So this is important as this can be used as basis for comparison when diagnosing an abnormal metabolite level to the adjacent normal tissue concentration. So after acquiring, we can now save the acquired dataset. And when we are viewing a spectrogram, we can also choose to show specific metabolites as well as the selected intensity. Specifically, when we select a specific intensity range, only those in range can be shown. So for example, in this slide, we have selected a 20 to 100% range and the metabolites are the choline and the NAA. Only those in the range or only those that we have filtered will be shown, and below or outside of that range is discarded and will not be shown in the image. So with 5% intensity range, we can see more metabolites in other areas compared to the 20% intensity range. And with 0 intensity range, we can see all the metabolic concentration levels within the voxels in our VOI. So with this approach, we can clearly localize where and which area has an abnormal metabolic concentrations. While in the SVS, the only selected single voxel will demonstrate the metabolic activities. So the SVS is a more specific spectroscopy approach compared to the CVI, and it delimits metabolites of the surrounding area to be detected and shown in our spectrum. So it is a bit impossible to do a comparison to other areas surrounding the possible pathology. So in summary, this is the difference between the CSI and the SVS results. So as you can see in the SVS, we only have a single voxel, while on the CSI, there are many or multiple voxels contained within our VOI. For our next topic, we will be doing the graph analysis. So this is an example of a brain spectrogram. It is consisted of a graph showing different concentration levels of different metabolites detected within our voxels. So for a normal spectrogram, first it should show an ascending graph with what we call a Hunter's angle. So the Hunter's angle is consisted of 3 metabolites, namely the NAA, creatine, and the choline. So the NAA or the N-acetyl aspartate should have the highest peak in the brain or in a normal brain with a 2.02 ppm, and the creatine should have a 3.02 ppm, and the choline should have a 3.2 ppm. So the NA, creatine, and choline peaks form a straight line and corresponds to an angle of 45 degrees, which determines normal from an abnormal MRS. So that is what we call a Hunter's angle. So it is one of the most common and most easiest way to determine abnormal concentration when a graph shows a descending data rather than an ascending data of metabolites. Now that we can read the graph, we will be reviewing the summary of related pathologies and most common metabolites according to Radiopedia. Due to time constraint, please feel free to pause the presentation to review a more detailed information on the potential pathologies associated with varying metabolic concentrations.
So in application to a specific pathology for the MR spectroscopy of the brain, we have here the glioma. Glioma is a common type of cancer in brain which accumulates for the 30% metastasis of the brain which came from the glial cell and 80% for the CNS. For glioma grading, we have 2 types. We have the low grade and the high grade. For high grade glioma, as you can see from the graph, it has a elevated choline, means that there is a high cell turnover, which means the formation of tumor is possible, and slightly reduced NAA, which means that there is a neuronal destruction because of the action of this normal cell into the tumor. And aside from the choline and NAA, we have also slightly increase of the lactate and the lipids.
So as you can see in this slide, we can compare the MR spectroscopy findings of a normal brain from those of a high-grade glioma. So to your left, it's a healthy brain, so the NAA is at its highest peak, the choline is low, and that shows the Hunter's angle that remains intact at a 45-degree angle. So that indicates a normal neuronal integrity and cell turnover. However, on the other side, it's the high-grade glioma. As we can see, it has different metabolic changes compared to a normal brain. So the NAA is significantly reduced, and that reflects a neuronal destruction. The choline is also marked elevated, indicating it means it has a high cell proliferation due to the increased tumor activity. And the creatinine, that remains stable or slightly decreased, which it signifies a disrupted metabolism. So as you can see, the Hunter's angle is disrupted with choline overpassing or surpassing the NAA, and also these metabolic changes lets us or helps us distinguish high-grade gliomas from both the normal tissue and a low-grade tumors, and that aids in diagnosis and treatment planning. Hence, MRS is very useful.